Hello everyone, good morning. Good morning to the live session. Welcome to my Insta followers as well as YouTube members. So again, we are live with yet another important topic, a must for every entrance examination as well as a fear topic. So every time I ask for what topic should I take, and one topic will always come in that list, and that is your Parks 3-step test. So we will wait for few seconds so that everybody can join in, and I hope my audio video is clear on both on the YouTube as well as the Insta. Hi Anil, Dr. Mittu, Dr. Aishu, Ashraf, Dr. Anil, Dr. Ashish, Shivam. Hello everyone. So you people were not getting, some of you were not getting the Telegram link. So I have added my Telegram link in the Insta profile. Hi Jogesh. So when you will open my Insta profile, there also you will get my Telegram link. All right. So let's get started about the Park 3-step test. Now there are two major limitations with this. Number one is that there are 3 steps, as the name suggests itself, that there are 3 steps in this test. We have the Parks 3-step test, and the second important thing is that you have to do it on your hand, and you will not have the pen and paper in the exam. So these are the major 2 limitations. So you should be very thorough in the steps that you are going, and once you go into those steps, answer will be yours. So that is for sure. Then you will not have any problem in solving the question. So let us take an example now, because this is for your vertical squint. Vertical means either there is hypertropia or there is hypotropia, but usually they will give you a question with respect to hypertropia, because clinically we do not say hypotropia, we will usually say hypertropia. Okay, so you have to see which eye is going into hypertropia or which eye is going into hypotropia. Now understand one more thing. Whenever I say that one eye has gone into hypertropia, suppose I say right eye has gone into hypertropia, then at the same time there can be a possibility that other eye has gone into hypotropia. So even if the left eye has a squint and or the deviation which is going down, when I will see the person, I would say it is other eye hypertropia. Means clinically I would always prefer evaluating or processing my patient in terms of hypertropia. So if they say in the question that a patient is coming with the right eye hypertropia, that means the other eye has gone into hypotropia. So if I say right eye hypertropia, it can be another thing, that right eye is on the same position but left eye has gone down. If the right eye was normal and left eye has gone down, then also there will be right eye hypertropia. So there are two conditions: either right eye has actually gone up, that is right eye hypertropia, or the right eye is at its normal position and the left eye has gone down, left eye hypotropia. Okay, so if I am saying that the right eye has gone up, so that means depressors of my this eye have been paralyzed. Okay, so depressors. Now what are the depressors? Depressor is the inferior rectus, depressor is the superior oblique. So right ka inferior rectus, right ka superior oblique can be the options. On the other hand, the other possibility is that left eye has gone down. So the elevators of my left eye have been paralyzed. Elevators are the superior rectus and the inferior oblique. So either it is inferior rectus or the superior oblique of this eye, or it is the superior rectus and inferior oblique of this eye. The step number 1. Have you got the step number 1? Can I have the thumbs up if you both of you have understood the step number 1? Is that clear? Either the depressors of this eye or the elevators of the other eye have been involved. So I have got 2 from this side, 2 from this side. That will make total 4 options, and 4 options may say any one option we have to choose. So we have got our step number 1. ठीक है ना? Now going with the step number 2. Going with the step number 2 may you have to see that. Hi Pratiksha, how is your preparation going on? How Sagar, hello. So okay. Now going to the step number 2. Step number 2 में क्या है? That it is increasing when the patient looks in which gaze? Gaze means direction. Either it is increasing when the patient looks in right gaze, or it increases when the patient looks in the left gaze. So suppose I say that it increases when patient looks in this right gaze. Okay. So when I am looking like this, my this eye will abduct and my this eye will adduct. So we are adducting this eye, we are abducting this eye. Now here you have to remember that the maximum elevation and depression in the abducted eye, ठीक है, abducted eye will be done by the rectus muscle. So here we were having depressor, so either it is the right inferior rectus, adducted eye में it is oblique, so I will take the left inferior oblique. Okay, so either it is the, because we are looking in the right direction only. So right will abduct, abducted eye may I will take the rectus, so it is right inferior rectus, or in the adducted eye it is the oblique muscle, so that will be left inferior oblique. Now once we have done with this, now out of the 4 options you are left only with the 2 options. Now go with the step number 3. Okay, now go to the step number 3. Step number 3 may you have to see about the head tilt. Head tilt means when the patient is doing head tilt on one side. Okay, so if the patient is doing the head tilt on the right side and it is increasing, now what does this mean? Here we have a very important reflex. What that reflex is? Vestibulo-ocular reflex. This reflex is called as vestibulo-ocular reflex. Vestibulo and ocular, I say balance is maintained. So whenever we are tilting our head to one side, now what is happening? Our eyes will go on the opposite side to maintain the balance. So my this eye will intort and my this eye will extort. Are you getting? Like I am tilting my head to this side. So my eyes will go to the opposite side like this, and this will go like this. So this is intorting, this is extorting. Now both were the inferior muscles, right inferior rectus, left inferior oblique, and inferiors will not intort. You know, yesterday I told you that superiors are intorters. We were remembering the sin. Superiors were intorters, and here we have both the inferior muscle. Now यहाँ पर because we have both inferior muscle, therefore we will go with the extorsion. So left eye का it will be left inferior oblique. That is why the answer will be left inferior oblique. So please see part 3 step test, step number 1, step number 2, step number 3, along with the vestibulo-ocular reflex and maximum elevation and depression in the abducted eye is by the rectus muscle. Maximum elevation and depression in the adducted eye will be by the oblique muscle. Please see if you have understood. So I will repeat this in Hindi now. Part 3 step test में क्या देखना है? That which muscle is involved in your hypertropia या hypotropia. जब भी हमसे पूछा जाएगा that which muscle is involved, है ना? तो one eye will go into hypertropia और दूसरी आई का इसमें जा रही है hypotropia में. तो या तो right eye hypertropia में जाएगी या फिर राइट आई नॉर्मल है एंड लेफ्ट आई इज गोइंग इनटू हाइपोट्रोपिया. ठीक है, अगर राइट आई हाइपर में जा रही है तो डिप्रेसर्स ऑफ दिस राइट आई आर इन्वॉल्व. लेफ्ट आई हाइपो में जा रही है तो लेफ्ट के एलिवेटर्स इन्वॉल्व हो गए. क्लियर है? अब क्या होगा? एलिवेटर्स ऑफ द लेफ्ट आई एंड डिप्रेसर्स ऑफ द राइट आई इन्वॉल्व हो गए. डिप्रेसर्स कौन से होते हैं राइट आई का? राइट आई का डिप्रेसर हो गया इंफीरियर रेक्टस, स्ट्रेट इन द सेम डायरेक्शन. उसके अलावा कौन सा डिप्रेसर हो गया? द सुपीरियर दी सुपीरियर ऑब्लिक। सो सुपीरियर ऑब्लिक भी हो गया, सॉरी इंफीरियर रेक्टस भी हो गया, और एज वेल एज सुपीरियर ऑब्लिक दोनों हो गए। फिर हम आते हैं लेफ्ट आई में। अब लेफ्ट आई के एलिवेटर्स इन्वॉल्व हैं। एलिवेटर्स में कौन कौन से होगा? सुपीरियर रेक्टस हो गया और इंफीरियर ऑब्लिक हो गया। तो अब हमारे पास 4 मसल्स हैं जो कि इस क्वेश्चन में इन्वॉल्व हो सकते हैं। इसमें से हम 2 को रूल आउट कर सकते हैं बाय स्टेप नंबर 2। स्टेप नंबर 2 में हमने बोला कि ये कब इंक्रीज हो रहा है? व्हेन द पेशेंट इज लुकिंग राइट साइड। तो जब पेशेंट राइट साइड देखेगा तो राइट आई एबडक्ट हो जाएगी और लेफ्ट आई एडक्ट हो जाएगी, ठीक है। अब यहाँ पर एक बहुत बड़ा कंफ्यूजन आता है फ्रॉम द रैड, रेक्टाई आर एडक्टर्स, तो वो उससे बिल्कुल भी इसमें कंफ्यूज नहीं होना है। वो टर्शरी एक्शन के लिए होता है, इसलिए वो फॉर्मूला वी डोंट हैव टू अप्लाई इट हियर, ठीक है। अब जब राइट आई एबडक्ट हो रही है और एबडक्टेड आई में कौन सा मसल यूज होता है? रेक्टस मसल यूज होता है। तो यहाँ पे आ गया राइट का इंफीरियर रेक्टस, और एडक्टेड आई में कौन सा यूज होता है? दी ऑब्लिक मसल, इसीलिए लेफ्ट का इंफीरियर ऑब्लिक। दोनों आईज के इंफीरियर मसल हो गया, एक का इंफीरियर रेक्टस, एक का इंफीरियर ऑब्लिक। फिर हम जाते हैं हेड टिल्ट पे। हमने बोला कि कब इंक्रीज हो रहा है? जब राइट का हेड टिल्ट हो रहा है। जब राइट का हेड टिल्ट हम करते हैं तो बैलेंस मेंटेन करने के लिए हमारी आईज लेफ्ट साइड में जाती हैं। अब राइट आई लेफ्ट साइड की तरफ जाएगी तो ये इनवर्ट रोटेशन है, इंटॉर्जन हो गया, और लेफ्ट आई बाहर की तरफ रोटेट करेगी, एक्सटॉर्जन हो गया, ठीक है। अब हमने पढ़ा था सिन, सुपीरियर्स आर इंटॉर्टर्स, क्योंकि सुपीरियर मसल इंटॉर्ट करते हैं और यहाँ पे दोनों इंफीरियर मसल है, तो जिस आई में एक्सटॉर्जन हो रहा है हम वो वाली आई चूज करेंगे, इसीलिए आंसर हो जाएगा लेफ्ट इंफीरियर ऑब्लिक। सो दिस वाज द पार्ट 3 स्टेप टेस्ट इन बोथ इंग्लिश एंड हिंदी। आई होप दोनों ही समझ में आ गया, एंड बिकॉज ये इंपॉर्टेंट टॉपिक था तो मैंने सेम टाइम पर ही इसीलिए रिपीट भी कर दिया। एंड आई नो ये एक वॉलेटाइल टॉपिक है तो आज आपने देख लिया है, लेकिन फिर भी दोबारा देखने की ज़रूरत पड़ सकती है, एंड दैट इज़ वाई अभी ये 1 वीक तक वीडियो रहेगा। प्लीज सी इट एज मेनी टाइम्स एज यू कैन, एज इट इज़ नीडेड टू रिवाइज द टॉपिक। एंड आज ही क्या कर लेना है? try to attempt also certain questions related to the part 3